Dr. Jacob Matthew, Medical Director, Dr. Jacob's Eye Care Hospital, Ernakulam, Kerala. I'm here to talk to you about the topic cataract. You would have a lot of doubts regarding what cataract is and how it is treated these days. So, starting off, I'm showing you a model of the eyeball. This is the eye, and it's a cross section. It's like a globe, and in front you can see the cornea. In the center you can see a hole there. That's the pupil. It's like the aperture of a camera with the iris, which is like a shutter. So it keeps increasing its size and decreasing as it regulates the light that goes into the eye. So it's like a shutter in the camera, and behind this shutter is the lens, a clear lens, which is the human lens that is there right behind the pupil inside the eyeball. And here the cornea and the lens actually focuses the light onto this orange colored membrane, which is actually an extension of the optic nerve, which is one of the main cranial nerves that comes from the brain, and it spreads out like a membrane that is called the retina. And this light rays actually gets refracted, it gets bent and then focused both at the cornea and the lens, and then it's focused onto the membrane for us to see the image of an object that we are viewing. So the power of the cornea is actually a steady, constant power, whereas the power of the lens goes on varying by a process called accommodation, where the muscles in the eye, the pupillary muscles and the ciliary muscles act together to increase and decrease the power of the lens. The lens is a flexible object, and so this is called accommodation. So when you see a far distant object, your muscles are relaxed, the accommodation is relaxed, and when you're seeing something at a nearby level, then you're focusing, you're zooming in to bring that letters or the details into focus. So this is the action of the lens and the cornea, or the iris and the pupil. So what happens in cataract is the lens becomes, from its it loses its clarity, it becomes opaque. So there's a degeneration occurring as you age, or due to some medicines or some diseases, the lens becomes opaque and white, and that is called cataract. So when does cataract come? The common cataract that we see day to day is senile cataract, that is age related. Usually it occurs in people who are beyond 60 years of age, or 55 or 60 years of age. But then it can occur even in a newborn baby. It's called congenital cataract. Later on, as the age advances, there's something called the developmental cataract, which can occur past 20 or 25 years, occurred due to some problems that have occurred during the birth or development of the baby in the mother's womb. So later on, it can occur even by around 30, 35 or 40 years of age. It's limitation, you can get cataract at any stage. So now the commonest being the senile cataract. So how is it treated? We have a lot of opinion or claims saying that there are medicines to cure the cataract. So this opacity can never get melted off, or it cannot be removed with the help of any kind of medicines that are prevalent these days. Only thing is, it gives a psychological satisfaction to the patient that for a time being the vision clarity is slightly improving, but in the long run it doesn't really help, and then finally it ends up with the surgery having to be done when the vision becomes really bad. And as the cataract matures, it's more difficult to do the operation as well. So what is the procedure that is done nowadays? It's called phacoemulsification. Clear corneal, topical, clear corneal phacoemulsification is what is done now. It's done through the cornea through a 2 millimeter wound. It's called micro-incision cataract surgery. It's done with the help of a pen-like instrument which goes in through this 2 millimeter hole, and then it cuts or it churns up the lens matter into small fragments and then aspirates it through the fluid that is going in. It is sucked out, and through the small incision we can implant a lens called a foldable lens. So how can the vision also get corrected? In fact, the vision can be corrected to what it was at the age of something like 20 years. And even if at 20 years you have been wearing a myopic glass or a hypermetropic glass or an astigmatic power, all those powers can be corrected. So you will be seen like you have never seen before. Plus, if you want even the reading power to be corrected in presbyopic powers, which comes after 42 years, you always have to use glasses for reading, whether your distance is clear or not. So even that power can be corrected with the help of multifocal IOLs. So present day technology, both the surgery has advanced highly, and as well as the refractive power correction is possible to a big extent, so that the patient actually goes through a pleasant experience. Even the surgery is totally painless. It's like washing the eye. It hardly takes 5 to 10 minutes for the surgery to be done. Doesn't require an injection, so it's done under topical anesthesia. Drops are applied and the eyeball is made painless, and surgery can be done very comfortably. And soon after the surgery, it doesn't require a padding of the eye. The eye can be kept open. You just need shielded glasses so that dust and any contaminants doesn't go into the eye in the wind or the air that surrounds you. So healing time is hardly 3 days for a micro-incision cataract surgery, which means by the 4th day you are prepared to have your head bath. You can go back to your work. A person who is working in the office can go back to his office work. He can drive. Mother at home, homemaker, can go back to her work as well, tend for the children, or start cooking and things like that. So this is how fast it has become. The rehabilitation of vision is also, as soon as the surgery is over, the patient is able to see, but clear vision is possible if there is no corneal edema from day one. The next day after surgery itself, the patient is able to see, but then the wound has to heal. So the 3 days is for the wound to heal, and then the person can get back to his normal work. So hope this was a useful, informative video, and it will be helpful to all of you. Thank you so much for your patience.